Assalamu alaikum, the communication day. First scenario, Adam, he is 32 years old man, was admitted to the hospital 6 months ago for a minor procedure. During that stay, his blood pressure was high several times, but no one informed him, and no follow-up was arranged. Recently, when he went for routine insurance medical check, he was referred to the hospital after his test result showed high creatinine 500. Ultrasound showed that both kidneys are small and shrunken. He feels completely well and has no symptoms. Explain to him the investigation result and the diagnosis.
Okay.
Yes, here you go.
Yeah, hello.
Hello.
Hi, my name is Dr. Hayola. I'm one of the doctors here today. Can I confirm I'm speaking with Adam, 32 years?
Yes, doctor.
Okay, thank you for coming to see us today. Today we are here to discuss about your health and the previous investigation that the investigation that you've done, okay, and the referral that we got for you. Okay, but before I start, is it all right if I check your understanding about what is going on with you?
Yes, doctor.
Okay, can you tell me what's going on?
Yes, so doctor, I was just doing a regular checkup for my insurance, and they said that there is something wrong with my test result, and they sent me here to the hospital. I'm not quite sure what's going on.
Okay, yeah, not to worry, Adams. We are here to discuss that, and I'm going to put you through about what is going on, okay? But if I may ask, do you have any particular expectation today?
Doctor, I just want to understand what's going on.
Okay, all right. So, you've had your blood test. You had your blood test done during the insurance screening for you, and there was an abnormality that was found in your blood. And what that means is that some of the waste products in the body that the kidney normally excretes, get rid of, is high in your body. Okay, and when things like that happens, the next thing is to find out why it is so. And one of the things we would normally do is to do an ultrasound to look out for the structure of the kidney. Okay, and in your own case, we've done this, and the scan has come back to show that the size of your kidneys, okay, on both sides are smaller than is expected to be. I know this is a lot of things I've said, but putting this together, both the kidney size and the test that you had that shows the increase in the waste product in the body, which is called creatinine, putting all both together, I'm sorry, Adams, I do not have a good news for you concerning this.
I'm not sure, doctor, exactly what do you mean by that.
What both of them simply means is that your kidney is not functioning properly, and you are suffering from what we call chronic kidney disease.
I'm not really sure why this is bad. I cannot understand.
I know it's a lot of is a big word, but I will explain it better to you. Okay, chronic disease means that what is happening has been there for a while, for more than 3 months. Okay, and it's affecting the disease, making the disease not to function properly, not getting rid of the waste product, and also handling the waste product in the body, giving you all of this. Okay, and when I look at your previous record of your previous stays in the hospital, it did show that at the time your blood pressure was high. Okay, normally when blood pressure is high like that, we would normally follow up patients, see how they are doing. If they need medication, we would supply to them and ensure that the blood pressure is well controlled. But in your own case, this was not done. And I'm suspecting that this might be the reason why the kidney is affected, because high blood pressure when the blood pressure is high, it affects the function of the kidneys and make the kidney to strengthen and eventually leading to the chronic kidney disease that you have.
So, what do you mean, doctor? Do you mean that this is something that should have done earlier, or what do you mean exactly?
Yeah, Adams, I know that this is, what the information I'm giving to you today is, it's something that we should have looked at deeply before it gets to the point of, affecting your kidney. But yes, this should have been looked into before now, because it was 6 months ago your blood pressure was high, and it has remained so in several hospital visits. And at that point, if something should have been done really to control the blood pressure. I'm so sorry, Adams, that this was not done in your own case, and that it has led to complication of the kidney affectation.
So, do you mean that you are the one who did this to me?
Well,
Do you mean that it was a mistake that happened?
I would say, Adams, at this point, really, because your blood pressure has been elevated on several occasions.
Yeah, I know my blood pressure was high, but if you did something at that time, this wouldn't happen. I don't know, doctor. I'm very young now, and I know if people kidney stop working, they will go on different. They will go to dialysis, and they die. They die because of this problem. I really can't understand how you can do such thing.
I'm so sorry, Adams, about the way you feel. Anybody in your shoes at this point will feel the same way. And the way you are feeling, it's so normal to feel this way. But I want to apologize again to you, okay? Because if the blood pressure has been picked earlier and we've commenced treatment, there are chances that we may not get to this point, okay? But at this point, I want to let you know that we would monitor you closely, okay? Monitor the blood pressure, and also look at, in terms of your kidneys, things that can be done to support the function of the kidney at this time. I'm so sorry, Adams.
So, doctor, can you treat this? Is it reversible?
Well, Adams, thank you for the question. It's quite a thoughtful question, but at this point, with the size of the kidney on the ultrasound, it's not something that we can reverse, okay? But we can manage it in terms of your symptoms. And I can see that right now you don't have any symptoms, but we will manage your symptoms, and we will try to prevent further damage to the kidneys by controlling your blood pressure. If you have any other symptoms, we would manage appropriately. But we can't reverse it. We can't cure it. I'm sorry, Adams.
So you don't think that I need dialysis, right? You just said that you will manage my symptoms.
Well, at this point, we will looking at your creatinine level. The creatinine level is quite high, okay? But there are other parameters that we look at it together. Other parameters, we'll do your blood test, we will do other things for you, and then we will discuss in our meeting. Then we can decide the possible treatment plan for you, which may include dialysis, which could be the one you do at home. We call it hemodialysis. It can also be peritoneal dialysis, the one you can do from your tummy. And we can also manage conservatively. Okay, that means we will not do dialysis. And in some cases also, kidney transplant can also be considered. But at this point, we want to evaluate you further to see which of them and is appropriate, and then we can discuss with you later, and we can agree on the treatment plan with you.
No, doctor, this is too much. This is too much to listen to. I really want to complain. I think this hospital made this problem for me. And I don't know, it cannot recover my kidney. What should I do now?
I'm so sorry, Adams. If you want to complain, it's your right to complain, okay? And I'll be giving you some information about the patient advancing liaison services. But also from our own end, okay, we'll look into it closely to see where things have gone wrong and what we can do to prevent such occurrences from happening in the future and to better help our practices. Well, I'm so sorry, Adams.
Okay, doctor.
But also at this point, it's also essential that we look at lifestyle changes that can help you. But do you like alcohol? Do you take alcohol, Adams?
No.
All right, that's good. I would advise you to continue in that line. And if you don't, also medication at this point, like painkillers, you should be careful with that. If you have any concern, you need to come to the hospital, and then we can be able to help with such painkillers. Okay, and
Okay.
I will also have the specialist nurses to speak with you, give you some information, and then we can sit down with you again after we've evaluated further to look at the treatment plan that is available for you. Once again, I'm sorry, Adams.
Okay, doctor.
Okay, do you have any other question for me?
No, doctor, that's fine.
Thank you.
Thank you very much, doctor.
Okay, perfect, Dr. Ayula, perfect, really. It was amazing. Thank you, Dr. Ayula. Dr. Kutov, can you comment now?
Yes, she did great job, really. She did amazing job. But I have few comments. This scenario is actually a mix of breaking bad news and a medical error. So she started by discussing the kidney function and what does it mean and everything. So I really would prefer if she started by that we are having the investigation result not right now and the investigation results are not good. And after telling the patient what is the result exactly and why it's not good, to explain more about the kidney disease. So now she had to explain the disease twice, before breaking the news and after breaking the news. So that would have saved some time for her. And the second thing, you didn't actually check the understanding, not even once during the whole scenario. You keep saying, okay, okay. I don't think that is considered as checking understanding. You have to check that if the patient is following you or understanding what you are saying, and if he has any questions, if anything need to be clarified more. So it would be better if you checked understanding of the patient more. And the other thing, you did not admit the error right away, and until the patient asked you if this is a mistake or no. You just, yes, you said that should not happen, but in cases of medical error, you should say directly to the patient that was a mistake, and you have to apologize for it. After admitting it, you have to apologize for it and give him the plan before him asking. You have to give him the medical plan and the legal plan as well regarding this a medical error. Other than that, you did everything really great. Thank you very much, Dr. Ayula.
Thank you so much.
Yeah, thank you, Dr. Kutov. I agree with you. She should admit earlier about this mistake. It's a mistake, clear error, Dr. Ayula. However, you apologized late, but at least you did that. So the examiner will consider that you apologize, and he will consider that you did this scenario as a mistake, which is good. That's why I said it was great performance. But please admit the mistake earlier. It's clear that he should be informed about high blood pressure readings frequently, and no one did that earlier, which is a mistake and a clear mistake, right, Dr. Ayula? Do you have any doubt about this?
No, no, no.
Yeah.
I know,
So
I know
please.
it's in one case, medical error and breaking bad news.
Yes, I know, but it was very late to apologize and to say honestly this is a mistake from our team,
Mm.
which shouldn't happen, right? It shouldn't happen, right? It's 100% mistake which can be prevented. However, you address the other concern related to this by telling him about the future plan, and which is important, very important thing here you would address the non-steroidal, the intake of non-steroidal for unnecessary or as over counter should be by seeking medical advice. And the alcohol, I think you didn't ask about smoking, did you?
No, no, I didn't.
Why?
Because I was running late, so I just picked on the NSAID and alcohol. No, I didn't. I remember, but I didn't.
Yeah, do it at once, okay? And the last thing to ask also the job. What's his job?
Okay.
Maybe it's a risky job for him. He shouldn't be there. Something occupational, might he's exposed to contact or exposed to any chemicals. So maybe he will need to be reallocated in another safe job. Please don't forget the job in any communication scenario. It could be one of the clues to convince a patient, and it can be also one of the weapon to use it, maybe related to the mistake or related to the disease he had. Not in this scenario in particular, I mean in general. Otherwise, really, you have a good and professional way to communicate apart from the late apology. Okay? You have any question, Dr. Aguilar?
No, but just wondering that this patient, that if I start with the fact that we've made a mistake, I was just wondering that will it not
Yeah.
trigger? I'm looking at the way that it would trigger the patient in such a way. So initially I thought about, yeah, letting the patient know about this in the first instance. But on the other hand, I was like, okay, let me tell the patient about the results. And then I will now then bring in that why he has this because of the hypertension that we did not tell him about. I was just being careful not to trigger the
Mm-hmm.
patient from the word go.
You mean you didn't want to give him two shocks? One,
Yes,
the disease as breaking bad news,
yes,
and the
and
second as a mistake from our team.
yes. So I wanted to do it at a graded thing, tell him about what's about his health right now, and then not then tell him about the condition. This because there is another scenario of this kind that I can't remember vividly, but there's something like this that breaking bad news and medical error, and the patient the way I would normally approach the situation is the patient that there are two things we need to discuss today. Two things. The first is one, break the I mean the diagnosis, the bad news, and secondly, another important thing we need to discuss is that previously, when you were here, we initially mentioned your blood pressure, which was not discussed with you, and this is the likely possible cause of this condition that you have. Normally, this should not have happened, and I apologize that this is an error from our part. That was the way I was planning to,
Okay,
because I.
so yeah, okay, I agree to do that or to do so, but don't be late. Okay, why
Mhm.
I'm saying that? Why I'm advising not to be late?
Okay.
Because you have an action to do,
Hmm.
and he will react, of course, as Dr. Gotov did, and she was professional and very perfect in the acting as a surrogate today. Suppose to react more, and she did that by saying, "I want to complain. This is your mistake," and you, of course, you have to compensate that.
Mm.
And but you addressed it well late. I mean,
Okay.
lately. Okay, you did it late. However, let her or let him, the surrogate, react earlier, not at the beginning, as I said. Maybe after the first instance when she asks you, "Doctor, is it a mistake?" Here you can answer it honestly. "I'm so sorry. I'm afraid to say yes, it was a mistake from our team.
Okay.
Usually, usually we are following our patient, telling them about what was ongoing with them, high blood pressure reading, and it might be with a bad effect on their kidney in the future, every now and then. However, in your condition, not done, and we apologize for this." So from the first instance, when she asks you, "Doctor, is it a mistake?" Yes, you address it as a mistake. You admit the mistake. You apologize immediately, and of course, acknowledging the mistake, which is good to your side as as a comment or feedback from the examiner will give you. It's okay. At least you did it. Better than not to do it. This is what I believe.
Mm.
Scenario
Mm.
that you did the apology, maybe late, but it's better not to be apologized.
Mm.
Okay.
Yeah.
Okay. I will read the scenario for you. Then we will be back to the comments. You are the medical registrar, renal clinic in the renal clinic. You need to speak with Mr. James Turner, at 42 years old man with autosomal dominant polycystic kidney disease. His latest test showed eGFR of 12 ml per minute, indicating progression to end-stage renal disease. The consultant has asked you to discuss the replacement therapy option for him for the first time. Mr. Turner is anxious because his father died while on dialysis and wants to understand his treatment options, lifestyle impacts, prognosis, and whether he can avoid dialysis. Your task is to explain why renal replacement therapy is now needed. Describe the hemodialysis, peritoneal dialysis, kidney transplantation, including living donation, and the option conservative management. Explore his ideas, concerns, and expectation, address his anxiety, check understanding. What is good in this scenario? It's complementary to the previous scenario. So we'll consider the patient already proceed to
Yes.
the end stage, but as only autosomal dominant polycystic kidney disease, not as frequent reading, only blood pressure high. Okay,
Okay.
Dr. Gutov,
Okay.
then we'll start. Anyone want to comment?
Yes, I just want to comment that she
Yeah.
did really great by the safety netting. Even though she was running out of time, she chose to do the safety netting. So that was really nice of her.
Okay, thank you. Perfect. So waiting for you.
Okay, doctor.
Doctor,
Yes, yes, Dr.
yeah,
Cham. You want to comment?
yeah, I just wanted to have a, I mean, for Dr. Ayula. So I just wanted to
Yes.
ask you that what exactly was the mistake or error in this scenario? Because I think that you mentioned to the patient that you said that I'm sorry that you had a high blood pressure and it wasn't communicated to you and no follow-up was arranged, and now your kidney has already been affected. So that's what I hear. But I mean, there's a possibility that when his blood pressure was high in the hospital, he might already have the kidney involvement, because if someone having hypertension, so it does not lead to CKD within 6 months, isn't it? It take at least 10 years. So most likely, I mean, there are exceptions, but most of the cases of chronic kidney disease generally they appear when you have a long-standing high blood pressure. So, I mean, saying to the patient that due to the high blood pressure only in the last 6 months that the kidney damage has occurred. So I think that might, I mean, it could be, but it's unlikely because generally hypertension has to be there for, and also your ultrasound appearances also suggest that he has bilateral shrunken fibrotic kidneys as well. So this means that this process has been going on for years. This is something which generally does not happen within few months. So I mean, the error in this case was that the high blood pressure was not investigated or not being followed up to find out what is the cause. But I think that the high blood pressure was not in the last few months. It wasn't the reason that the patient went into frank renal failure and all these things. So I think that because I heard you saying that, and you apologize for that, that the your blood pressure was high and we didn't follow up, and now now your kidney have this problem and you have a kidney failure. But it, as I said, that there might be a case that the kidney already have been affected by the time his blood pressure was high. So this is something. My point is that the error was just to not to communicate the high reading and not followed up with that. And kidney failure, it might be there even when he had a high blood pressure, so that wasn't investigated at that time. So that's my take. I mean, so shrunk, my point is that CKD generally and shrunken kidney, they generally does not appear within months. It generally take years for them to develop. So the error was that patient high blood pressure was not taken seriously and it wasn't investigated further, and now it has been investigated and now they have found out, okay, so there's a possibility that even few months ago when he had a high blood pressure, if you might have done the scans and readings, he might still have the problem at that time as well. Yeah, thank you.
Yeah, thank you, Dr. Hisham. I agree with you. It will not be with a month or within couple of months. But what's written in the scenario that he should be informed about blood pressure, which is not happened. So maybe even the blood pressure reading wasn't obvious for the patient for the last years. Maybe he doesn't did this checkup and he didn't know that the blood pressure is high. But what related to the scenario as a mistake, we have to admit, as you said, yes, it's written, so we have to admit the mistake from the part written in the scenario. Although it could be from since long time before, but this is not our mistake. If he didn't do the checkup, maybe he's the one didn't do the checkup earlier, and that's why when he discovered by us, it was maybe late, but it's not our job to talk about the past, why he didn't present earlier. Okay?
Yes, yeah, I agree, Dr. Basi. My point is that just take it as a scenario. For example, if the patient, when you tell the patient that we are sorry that you were not informed that you had a high blood pressure and now your kidney has. So if the patient says, okay, because of your negligence, your error, now my kidneys have gone into a kind of a failure. So, and he's more kind of a angry and threatening in a way that he will be complaining that
Yeah,
due to
yeah,
the fact that you were. So my point is that in that case, we don't need to go on the back
yeah,
foot
yeah,
and be
exactly. No,
defensive,
no, no.
because we know that the kidney failure is not
Yeah,
something which is only in the last few months.
yes,
There is a
yes.
good,
You're
yes,
right.
from our side, the error is that the blood pressure was not investigated and it was not
Yes,
communicated or
exactly.
follow up. So the kidney failure, I mean, my point is that if the patient says that due to your mistake, my kidneys are gone, so this statement could potentially be wrong. So you don't need to be on defensive. Yes, admit that your blood pressure, but even at that time, you might have
Yes,
kidney
yes.
because it was not invest. That's my point.
Yeah, yeah, I got it. So it's not it's multifactorial, not only your high blood pressure for the last couple of months. Yes, I agree. Agree. If he asked in details, doctor, do you think like I had before this condition? You can say some patients, yes, they cannot be appeared with this problem even with the symptoms. Sometimes high creatinine or high blood pressure cannot, not all patients with high blood pressure, they are presenting to us with symptoms. Sometimes they are discovered as a checkup during the either annual checkup for the annual insurance or maybe for other presentation like doing surgery. So don't assume that it's clear only a mistake because of our missing hypertension readings. Yeah, if he asked in details. But since it was written related to the blood pressure reading, stick to that. Don't talk about the past. Yes, I agree with this point with you. Okay.
Yes, and secondly, I think that when you were telling the management and all these things, I don't know whether you mention about involvement of the kidney doctor or not, because obviously that would be so. I think that we need to tell the patient that which of the other team members,
Yes,
because
exactly.
yeah, so I think you need to involve the kidney team as well, the renal team. I think that's something which would be appropriate as well.
Yeah, what Dr. Ayula touch, the non-steroidal or the medication or over-counter medication is perfect. But also you can add the dietitian. You can add multiple or group of doctors. They will follow you. One of them are dietitian to give you some instruction about the food, what type of food you have to take, what you have to avoid. Even the fluid. Some people will get benefit from high plenty of water, and other will be restricted. Maybe they are edematous or high volume, so you can restrict them. So you don't know, but at least refer to a group of doctors in any
Mm.
scenario, not only in this scenario.
Yeah.
You, yes, you're right.
Yeah. So because at the moment we don't know that what is the cause of the kidney
Exactly.
failure. So just need to tell that the patient needs
Yes.
further investigation first of all, and
Mm.
that to be done by the renal team to
Yes.
find out what's going on, and then only one can make an appropriate plan.
Yes. Okay. Thank you, Dr. Hisham. I hope Dr. Ayula heard this comment also because you can add to your performance that in any scenario, please involve group of doctors including the specialized nurse, the dietitian. They might help in your diagnosis and in your management in the future. Okay, so let's start. Dr. Gutuf, ready?
Yes, doctor.
Yes, here you go.
Okay. Hello, I'm Dr. Abdulsalam. I'm one of the doctors in the kidney clinic today. Are you Mr. John Turner?
Oh, yes, doctor, I am.
Nice to meet you, Mr. John. So I'm
Okay.
here to talk about some updates about your health condition. Is that okay with you?
Yes, please.
Do you want us to wait for anyone else before we start talking?
No, I'm good.
Okay, that's great. Could you please tell me more? What do you know so far about your health condition?
Yeah, doctor, I've been having some concern about my urine recently, some tummy ache. So I came to the hospital and I was told I have a condition, affection of my kidneys. Okay. They've explained to me and told me that my kidney is is getting to the point that I might need support. So I've been asked to come today to have a conversation about the support available to take care of my kidneys.
Yes, that's right. I really appreciate your knowledge. So, yes, what you said is true. Your kidney has reached a point in which it needs support to be working because your kidneys are not working anymore enough to clean the waste out of your body. So, for now, we have many options actually in order how to deal with this issue. There is four options we're going to talk about today. Are you following me so far?
Yes, yes.
Do you have any expectations?
I just want to know the options available and look at the ones that would be best for me.
Okay, that's great. So the options we're going to discuss today are support of the kidney, which are the hemodialysis, peritoneal dialysis, a kidney transplant, and conservative management. Don't worry, I will talk about every single one of them in details. Okay?
Okay.
Okay. So regarding the hemodialysis and peritoneal dialysis, we're going to discuss them together because, to be honest, they have the same concept. In this case, you will have an artificial device that cleans your body from the waste. It acts like an artificial kidney, but the location of this device differs. Are you following me so far?
Mm-hmm.
Yes. So in the case of hemodialysis, we use your blood and we take it out of your body and it run through a machine that clean your body from this waste and toxins and it bring it back to your body. So for this, we need to do a connection in your arm, most commonly, between your blood channels in order to do that. Have you ever heard about this hemodialysis?
Oh, yes, yes. I've heard about hemodialysis before previously. Yeah, my father had hemodialysis and he unfortunately passed away during this procedure, which is something that makes it more scary to me. So I don't know, it's quite scary.
Oh, I'm really sorry for your loss, and it must be really hard for you to go through the same thing again. So I will try to make it more clear for you. So hemodialysis, it has its own risk as any other procedure. So regarding the hemodialysis, as you may know, it takes place in the hospital. So we need to do a connection in your blood vessels, and you have to go to the hospital approximately 3 times per week, and it might take up to 4 hours every day you go. Are you
Mm.
following me so far?
Yes, I am, doctor.
Yes, and one of the side effects that might happen due to this procedure that you might feel dizzy after the procedure, you might feel fatigued and you are required to do some fluid restriction, so you will not be able to drink as you want. And you might caught an infection as well. But
Okay.
I don't need you to worry because we're going to be following you every time you go to this procedure and you will be surrounded by nurses. And one of the benefits of this option that it's done in the hospital, so the nurses take care of everything. There is nothing you should do other than just to show up at the hospital.
Okay.
And it can be used long term as well. Are
All
you
right.
Am I making sense?
Yes, you are making sense, doctor. Yes.
Yeah, and regarding the peritoneal dialysis, if you don't like going to the hospital 3 times per week, like you like traveling or you don't have a flexible schedule for that, so there is an option of peritoneal dialysis in which they basically use the place in your tummy. There is some fluid inside your tummy. I will draw it for you now. This is your tummy. There is a place here in which there is fluid that's surrounding your tummy. So they will put a device inside and they will put some fluid. It's called dialysis fluid. And it takes all the waste from your body and put it out of your body. You can do this at home, even when you are sleeping. Is that clear?
Yes, yes, it is clear, doctor.
Yeah, so this procedure gives you more independence, given that you can do it at home. But one of the problems that related to it that it has too many equipments, and you have to take time to process it yourself. And the other thing, it carry as well a risk of infection and a risk of problems to your tummy.
Okay, and is there yeah, I understand, doctor, but do you think is there any reason why I can I cannot have this done? I mean, is there any, do you think I'm fit for all of this?
We're gonna assess you after this session, and we will see, because the peritoneal dialysis, we need to make sure that you don't have any problems in your tummy, any previous surgeries, for example. And regarding the hemodialysis, we need to make sure as well that you are fit for them. But for now, I need to know all of the available options we have.
Okay, yeah. Thank you, doctor. Yeah.
Okay, that's great. So the other two options we're having, one of them is the kidney transplantation. So both of the first options were like using an artificial kidney, but in this type of treatment, you will have a real kidney implanted into your body, which will start working after
Mm.
that, and you will not have to go on dialysis or to use any machines. But the main problem with this thing that there is a long waiting list usually, unless you have someone that is close to you who is willing to donate and he's a match with you. So, and you need for the surgery as well.
Okay, yeah.
Okay?
All right, that's quite good to know.
Yes, and regarding this surgery, there is also the surgery risk, of course, like any other surgery, do like bleeding, and after the operation, you have to go on immunosuppressants, which are medications that lower your defense system. And unfortunately, you have to be on these medications for life. So it will really impact your defense system, and it will make you more prone to infection.
Mm-hmm.
Makes sense?
Yeah, it does make sense, doctor.
Yeah.
Yeah.
The most comfortable thing about it that you will just be living your life. Like you don't have to go to dialysis or do dialysis at home.
Mm.
Okay.
You too.
So the last option we're going to talk about is conservative management. In this case, we're not going to give you anything actually. You will not receive any dialysis, any type of dialysis, any kidney, and we're just gonna manage you and see what symptoms you're gonna develop and treat these symptoms accordingly. But the main problem here is that your kidney function is going to deteriorate eventually, and that is so unfortunate. Eventually, you're going to develop some complications, and you're gonna develop problem in other organs in your body. And I'm really sorry to tell you that it most probably gonna shorten your life.
Oh, that's also scary. But doctor, of all this, I know you've just given me a lot of information about this
I know this is a
options
lot
that
of.
I have. Yeah, but I'm just worried first about the dialysis because my father died on the machine, and it's quite worried to me. And I don't know, it's not something I would want to consider because I don't also want to go through the same thing my father went through.
I'm really sorry for what you went through. I know this is traumatizing thing to be in, but I'm really not sure what happened exactly to your father. But death is one of the problems that can happen due to the kidney problem itself. So it
2 minutes
might be
left.
not even directly related to the hemodialysis. It might be related to the kidney problem itself.
Okay, I'd say. And will any of this cure me? Any of these options, will it take away my condition?
To be honest, neither of them will cure you. Even though the kidney transplant is one of the options we discussed, it will make you live a near normal life. But this kidney transplant itself, it might fail even after 10 to 20 years. It might fail also. So you might even have to go to the same cycle again.
Okay, all right. Oh,
No,
there's
this
a
is
lot of
really
things
tough.
to think about. So,
Yes, yes. I just want you, you don't have to decide now. I just want you to think more about this, explore your options, and see what works better for you given your lifestyle and what you want and what you value in life.
okay, doctor.
Okay. So, do you have any more questions?
No, no.
Okay, that's great. So, I just want to ask you a few social questions. With whom you are living?
I live with my wife.
Okay, so are you fully supported?
Yes, I'm fully supported. Thank you, doctor.
That's great. What's your job exactly?
I work as a warehouse officer and it's quite going well. No concern about that.
That's great. So I just want to ask if you smoke or drink alcohol.
Yes, I do smoke cigarettes, but I'm
Okay.
trying to cut that down now.
Yeah, that's great because really cigarettes really affect your health negatively, especially given your condition. So I can help you by referring you to the smoking cessation clinic if you want.
Okay, doctor, thank you.
Okay, so for now, I advise you not to take any medication that can affect your kidneys before discussing with your doctor. And if you felt any shortness of breath, if you felt any swelling in your legs, and if you had any high fever, I advise you to come to the hospital directly and seek medical care. And I can give you our number by the end of this consultation to contact us in case of anything happened.
Okay, doctor, thank you.
Okay, so for now I can give you some brochures and some reliable websites to read about this dialysis options. I know the time is not enough in this session, so I can arrange another session after you explore the options and you can decide which one is working better for you.
Yes, that'll be quite helpful, doctor. Thank you.
Okay, thank you very much and nice to meet you.
Yep, thank you.
Okay, time's up. Perfect. Amazing, really, Dr. Goto. Well done. Dr. Ayula will comment, then I will comment.
Oh, well done, Dr. Gotov. Gotov, yeah. Thank you so much. It was a good presentation. You were able to cover the most of the the tasks, all the tasks. You were able to identify and did all the tasks, which is quite good. Okay. But just one thing some things I just wanted to point out to you. Maybe could make the presentation more better. It was good presentation, but you explained so much about each of this procedure. Fine, you need to tell why we're doing it, and the reason why we are doing it, the risks and benefit of each procedure. But I think just a little of each of them would be good, and also the renal transplant as well. You explained into the full details and the conservative management. You told me about reason. At that point, you need to just let the patient know that I've given you a lot of information, which you did eventually. And but at that point, let the patient know that is there anyone, because you need to let the patient know which one at that point does he want to. But you need to ask the patient, is there any one of this that you think you will want more information about? That is in the piece of shared decision making. Is any one of these procedure things that we've discussed today that you want more information about? Just I want to go and think about it, and then I will come back. Just to let the patient know that you have to make decision about this, and then we'll give you more information about it. Then another thing is you need to also let the patient, because it's going to be a lifetime thing that would affect patients' life. I mean the total. I mean the patient's life entirely. So you want the patient to know that when next you're coming for this appointment, I would advise that you come with a family member if it's something you want to do, so that he can support you. You need to do the patient needs to carry advice that he carries family members along. That's another thing that you may need to let the patient know. Then I have to ask you about the date of the father of the hemodialysis twice before you answer the concern. The moment you speak about the hemodialysis, I asked you at that time, you shoved it off. You didn't pay more attention to it until I asked you the second time, which you eventually did. But altogether, I mean, you did so well. You address you address all the tasks in the question, and you answer all my concerns. Well done. Thank you.
Yes. Thank you, Dr. Ayula. I agree with your comment. She did amazing. The only point I wanted here to say or to add, because I cannot have any comment for her, the only comment regarding the father, I think she touched it at the end, but I'm not sure if she said, I'm so sorry about your father loss or anything, sympathy or empathy.
Yeah, I said that. I said that I'm really sorry about your loss and that must be very
Yeah.
traumatizing. So
Yeah, perfect. The other thing, as Dr. Aida said, he must have some information about renal dialysis or renal replacement. One of them, the renal dialysis, or maybe the other. So you can ask, do you know anything about them, or did you hear about them before, as your father was one of this disease having. So he must know some of the information. He can shorten your time if he speak some of this talk, so you can also have some time to save some time for other tasks. Otherwise, every procedure you did in every procedure shortly, which is good, but I prefer also to add a consent form whenever he will choose one of these methods, he should sign a consent form. I think you just missed this one only, right?
And I think asking about if he knows about any of these, it will save me some time because it was a lot of things to discuss.
Yes. But at least you give one side effect or complication for everyone. At least one, or the most common. The commonest side effect or complication might happen. It will be fair enough for everyone. But in general, you did perfect. It's a multi-task in this scenario, which you cover all of them. I agree, as Dr. Ayula said. Thank you, Dr. Gutov and Dr. Ayula. Any question or comment?
Just to add, so Dr. Kutuf, you really did very well. You just touched like many aspects of most of the task in the um in the um in the scenario. So I think you've done really well, but just a bit of like patient sharing decision. So you're just like checking every now and then if the patient is following you, and that's a very good point. But if you after each option just to share with the patient, are you is it is something you are interested in, or what do you think about this option for you? So I think that will be also giving you more bonus in the scenario. But overall, very well done.
Yes,
Thank
I agree. Yeah, you can ask him at the end one question. What do you think about the options we give to you today? He will give you at least, okay, or let me think, doctor. I'm prone to start this or that. So at least to know what he's choosing at least once as a question, and that's it. But in general, as I said, it's okay. But please provide a consent for any procedure. So please tell him or let him know that every procedure you will have a consent form. You must or you have to sign it before starting or initiating this process. Okay. Thank you, Dr. Ahad. Any question, Dr. Gutov, you want to add? Or any comment from Dr. Ayula?
you. No, it's just a really nice scenario. Thank you, Dr. Ayula.
Okay. Yeah, both of you will be lucky if you have this scenario next week.
Yes, sure.
I guess Dr. Ayula tomorrow, right?
No,
Or
yeah,
after tomorrow?
after.
Okay. And Dr. Gutov later on. Okay. Any question, comment before ending the session? Both of you
Uh,
are ready? Yeah,
yeah,
okay, Dr. Aksham.
Dr. Basim, I mean, because it was a very kind of a lengthy scenario. I mean, there were three, four tasks. You need to explain hemodialysis, you need to explain peritoneal dialysis, you need to explain renal transplant, and then you need to tell about the conservative management, which obviously mean no management and just the management of the risk factor, which could lead to further progression. So, I mean, I feel that it would be difficult to go in a lot more detail about these things, because even if you are giving suppose 1.5 minutes to each of these things, so it will make up around 6 minutes, and then to check the understanding of the patient. So I think that I feel that if this kind of scenario comes up with so many things to explain, so it will be difficult at time, and you basically it will feel like that you are rushing through that, and obviously that's not your fault, because you need to complete the task. So I think that one thing about this scenario obviously is that I don't want that scenario to come to any of you with all these detailed tasks to be done, because I think that time management would be an issue. Yes, if it is only about to discuss between peritoneal dialysis or hemodialysis, then it's just about two things. I think in that case, time management can be done. But I personally feel with all these things, and to also make sure that the patient is on board as well, and checking understanding, and then at the end discuss and about the social impact and all these things. So I think that time management, I generally feel that it would be quite a task to manage all these things. That's one thing I feel regarding this scenario. Second thing is, I think that, I mean, obviously the patient has, we know that the patient have an advanced kidney disease. So is already in CKD 6, having a creatinine clearance of 12.5. So You can, I mean, obviously, Dr. done very well. So the other way of doing it, I mean, there is no right or wrong, that you can just simply start by asking the patient just to tell that, okay, what your understanding is about your kidney disease and what exactly you know about the functioning of the kidney, just so that the patient, if the patient says that I know that my kidney having a very advanced disease, and I know that the kidney basically it functions to remove waste from the body. So if you know that, and then you can pick it up from there and say, okay, now you know that your kidney is not functioning properly, so we need to find out a way to get rid of the waste from your blood. And that's why I'm here, and I will be going to discuss with you the options we are having, and then you can take it from there and explain one by one that what we have two options, which are rather not permanent options, and this is which we'll call a kind of a wash out or washing the blood and take those waste material. And then you explain one of them is through your blood channel and the other one is through your skin from the tummy, rather than, because I think that saying hemodialysis obviously will be a technical term. So you just can simplify for the patient that there is one of the procedure to take these waste product out of your blood is through your blood channel, and the other one is through your skin from the tummy. And then explain that through the blood channel we need just rotate your blood through that the machine, and it washes that blood and it being put back into your body. So this is one way. So I mean, just to make it easy in terms of the understanding of the patient. And after that, I don't know that whether Dr. Kodaf had touched that point, because we all know that at the end, out of all these things, the jury is generally in favor of a renal transplant. So I think that you need to tell that clearly to the patient. Out of all these options, the the best one in the long run, as the patient is very young, just 42 years old, so the best option is obviously a renal transplant. Yes, it is a surgical procedure. We need to find a match for you. Ideally it has to be some family member, but if we are able to arrange for that, that is the best option with the most likelihood of long survival with relatively less complication, because that's something we all know is the preferred treatment. So you discuss all the options, but you need to tell these things to the patient. If the patient says that, uh, yes, I want to go with the peritoneal dialysis or hemodialysis. So we know that hemodialysis and peritoneal dialysis, it is not something which we generally go with on a long term basis in someone as young as this gentleman. So he is a potential candidate. So you should put your, I mean, kind of a weight. You need to clearly, because the patient said, okay, patient might feel that all these three things they are equal, which is wrong. It is not that all these things are equal. The most benefit the patient like this one will get is from a renal transplant. So you need to, during your discussion, you need to emphasize that point, that based on your age, because you are very young, so generally out of all these treatment, renal transplant is the preferred one. And I think that that can help the patient as well in making a decision. So yes, because you cannot just tell these three things, and the patient does not know which one is of benefit to him. It is just like, for example, if you are explaining someone for a non-invasive kind of, or a minimally invasive, like a percutaneous angiography or percutaneous coronary intervention versus cabbage. So there are some situations in which you might prefer one over the other, but here we all know that clearly in someone as young as this gentleman, the preferred one is a renal transplant. So you need to put, as a medical professional, you need to put your weight on towards that side and tell the patient clearly that, in my opinion, this is the preferred one. And I feel that this is something which you need to, as a temporary measures, till that is being sorted, you can choose either between a hemodialysis or a peritoneal dialysis, but it should just be a temporary measure. So I think that's something I feel that should be communicated very clearly to the patient. Thank you.
Yeah, thank you, Dr. Hacham. I agree with you. If he asked me, what do you think, doctor, the best one, the easiest one, which one is having long stay or long term benefit? Yeah, I will go with the renal transplant as long as the patient is young. Since this patient doesn't talk about it, as well as the scenario is not pushing to one of these, so I will not talk about the preference. I will wait for his question. What do you think, doctor? Or I will ask him at the end, what do you think, which is fitting you, or what you are thinking about, since you have or you had earlier background with your father having. So he will ask, then I will give
I
to him
think,
the preference. Yes.
sorry, Dr. Basim, for interruption, but I
Yeah.
think the renal transplant is the preferred choice for all the patients. So literally here in the UK, they just like do the renal transplant even in 70 years old patients. Unless there is like obvious contraindication to the surgery or there is a high surgical risk.
Yes,
So
so yeah,
this
I
could be
agree. I think
obviously.
that's what I'm saying, that being a doctor who is working in a renal clinic, and if you come across, so you need to guide the patient, put your weight towards the renal replacement. It is something which is the preferred treatment. Yes, unless and until you don't have an arrangement for a donor, only during that time. So my point is that you need to be clear when explaining, because the patient is, I mean, it's just a layman. He might understand, okay, even why should I go for a surgical procedure when I can have a just have a needle in and just have a hemodialysis or a peritoneal dialysis. So he will feel, okay, there's no benefit of going through such an invasive surgery if I'm going to survive the same whether I do a peritoneal dialysis or a hemodialysis. So what's the point in going for a surgery? So this is my point. If you are working in a renal clinic and you have been given a task like this, you need to put your weight towards the renal transplant. So even if it is not mentioned in the scenario, still you need to tell the patient, because if you say to the patient what you feel about that, and I will say, okay, doctor, I want to go with the hemodialysis, and you'll say, okay, we'll start the hemodialysis. It is not like that. You have to counsel the patient. You need to tell the advantages and disadvantages, that these renal replacement in the form of dialysis, it is just a permanent, not a permanent measure. These are just temporary measures, and the best long-term management is a renal transplant. So this is my point, that you need to touch that even if it is not written in the scenario.
Yeah, I
Okay,
got
Dr.
you.
Ash.
So
Yeah.
yeah, yeah. This should I mean this should come by default to the patient understanding when you just like explain about the different option for the renal processing therapy. So when you come to the renal transplant, you will explain to the patient that this is the definitive management of of your kidney disease. So this will come by default to his understanding that this is should be the preferred option, and they will ask for it just before you suggest anything for this option. So what I recommend that you can ask the patient about the hemodialysis and the peritoneal dialysis as temporary measure what he's thinking about, and definitely the renal transplant surgery will be the definitive management, or the last like the definitive option for him.
Yeah. Oh,
Yeah.
anything else, Dr. Ahan?
No, thank you.
Okay. Yes, I agree with both of you. As all of us know that this procedure, either peritoneal or hemodialysis, are bridging for the renal transplant. Since the list of transplant takes long, so all of them they will wait until they will find the good and appropriate donor, right? If he asks again, it's okay. I'm not saying it's not your task to prefer or to say this is the preferred. No, I'm saying maybe written in the scenario or not. So as the scenario, as the task in the scenario, we will follow. If you are the renal doctor and you prefer this over that, it's okay to mention if he asks or if you have time. I don't think with these all tasks and procedures you have time to say please the most or the best one of these, this one. But you can say, as I said earlier, both of the peritoneal or hemodialysis, both of them are a bridge procedure or technique for the long-term management, which is the renal transplant. So of course I will prefer this. So Dr. Kotov will add, or she can add to her approach, that these are the transient. I mean the renal dialysis or the peritoneal dialysis. They are bridges for the transplant, which is the long-term management. You will be added to a list, and unless you have a good donor, live donor, who can give you kidney, you will be in the waiting list. Or you can arrange with him or her to have the kidney as soon as possible. And the most important, to have good matching with them. So again, I'm not saying it's wrong. Yes, you have to mention to prefer it, but by the way, or all the way, will tell that this procedure will be temporary, both of them, and the end or the long-term management will be the transplant. Okay. Anyone want to add any comment about what we mentioned, or to add anything else? Yes. Sorry.
Thank you, Dr. Basim.
Yeah. Yeah.
So I think that's what I mentioned in the start as
Yeah.
well. I've commented in the
Yeah.
chat box that this scenario actually it
Yeah.
is not an easy scenario in terms of
Yes.
time management because there are number of tasks and you just have 10 minutes. So
Yeah.
it will be, I think that Dr. Kodaf did very well, and especially I think she realized at the end as well that there are a lot of things, and she rightly offered the patient that it's too much to take. So I think that you can have a look at these things, the
Yeah.
brochures and all these things, and we can have another meeting because you're not going to start dialysis right
Yes.
away. So I think that's pretty appropriate, especially in a long scenario when you find that the time management is difficult. So I think that was very good actually.
Yes. I agree with this. Yeah. Yeah. You can say in another meeting we can update you more about the details of this or that, and the long term or the best way. Don't worry, we will be following up you every now and then for this procedure or for the long-term management, which is the renal transplant. Thank you, Dr. Hasham, again, and Dr. Ahad. Anyone want to add a last comment before ending the session? Or a question? It's not only comment. Anyone have any doubts? Okay,
Just
so
I wrote for Dr. Kutuf in the chat box. Just mentioning as you mentioned the fistula for the hemodialysis. Also mentioned putting peritoneal dialysis catheter before starting the dialysis. The
yeah,
peritoneal dialysis because it's a procedure and carries its own risk also.
yes.
So yeah, just this point.
Yeah, I think in general, Dr. Gutov, she did it. Really, it's a difficult scenario, lengthy one, but she did all of them. She covered all of them, apart of the consent form, just to provide it. Even she had the time to talk about the social, which is also something can be missed in such scenarios. Thank you, Dr. Ayula and Dr. Gutov, for the participation today. Thank you, Dr. Hasham, Dr. Ahad, for the comment, everyone, and the questions. Regarding the performance tomorrow, maybe I have some social issue. If I have time to do, I will post in the WhatsApp group. And if no, we can postpone tomorrow and we will start from the Saturday. Sorry, from the Sunday. Okay. So I cannot say have a nice weekend. Still, we have one day in the weekend, so enjoy your Saturday. Maybe we will have a session or no. I will write it later on. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.
Walaikum assalam.